name's Cam, and this is Polly, and today we will be showing you how to properly position a patient from supine into a sideline position. Before you actually start working with a patient, it's always important to get their consent, because if they don't want you to work with them, you can't. Then, the next thing you'll do is you'll want to clear the area of any hoses, tubes, or sheets so that nothing gets tangled in the patient while they're being repositioned. After that, you're going to want to check their clothing, because patient modesty is important. And if their clothing is going to expose them when they're moved, you're going to want to fix that. Then you're going to want to make sure if the patient is able to assist you in the movement or not. So today, Polly will be acting as a dependent patient. The final thing to remember is proper body mechanics. If you hurt yourself while you're trying to help the patient, it's not good for anyone. So the proper position to have the patient in before you initiate the movement is, since we're rolling Polly onto the left side, we're going to have her slightly off-center toward the right of the bed. The first step in rolling the patient onto their side is to position the patient's arms and legs appropriately. Since we were rolling Polly onto her left side, I'll place her left arm into 45 degrees of abduction and place her right arm over her chest. I will then put her right ankle over top of her left. Next, the therapist will place the hands underneath the shoulder and hips and then push the patient into a sideline position. Are you ready to be positioned? 3, 2, 1, go. Once the patient is on their side, you can then place pillows under their head and between their legs and on their front or back, depending on how they would prefer, and help them into a proper sideline position as seen in a different video. To return a patient from sideline to supine, you want to do all those steps in the reverse order. So take the patient's left arm, place it down, keep the right arm crossed across their chest, and put their right foot in front of the left. Then, using the same hand positions, you will lower the patient back onto a supine position. Another way to reposition the patient from supine into sideline is by drawing the patient toward the therapist. For this, you'll position them the same as the other method, with the left arm in abduction, the right arm across the chest, and the right ankle crossed over the left. Then, on the other side of the patient this time, you'll use your right arm underneath their shoulder and your left underneath the hip, and then roll them again. Are you ready to roll? 3, 2, 1, go. You would then appropriately position the patient into the sideline position. To return the patient from the sideline position into supine, you would once again position the patient appropriately, putting the right foot in front of the left, bringing the arm out, and leaving this arm crossed at their chest. You would then, using the same hand positions as before, gently lower the patient onto their back. And then you would return the patient into the appropriate supine position.